Safer sex practices are essential for promoting sexual health and well-being. In a world where sexual relationships are a fundamental part of human experience, understanding how to engage in these relationships safely is crucial. The importance of safer sex practices cannot be overstated, as they play a vital role in preventing sexually transmitted infections, reducing the risk of unintended pregnancies, and fostering healthy relationships. To begin with, it is important to understand what safer sex practices entail. At their core, these practices are strategies and behaviors that individuals can adopt to minimize the risks associated with sexual activity. This includes the use of barriers, such as condoms, dental dams, and other protective measures, as well as open communication with partners about sexual health and history. The foundation of safer sex practices lies in education and awareness, which empower individuals to make informed choices about their sexual health. One of the most effective tools in safer sex practices is the use of condoms. Condoms are barrier devices that can significantly reduce the risk of sexually transmitted infections, including HIV, gonorrhea, chlamydia, and syphilis. They also serve as a reliable method of contraception, helping to prevent unintended pregnancies. It is essential to use condoms correctly and consistently to maximize their effectiveness. This means checking the expiration date, ensuring the package is intact, and using a new condom for each act of intercourse. Additionally, using water-based or silicone-based lubricants can help prevent breakage and enhance pleasure. While condoms are a widely recognized method of safer sex, it is important to acknowledge that they are not the only option. Dental dams, for example, are thin sheets of latex or polyurethane that can be used during oral sex to reduce the risk of transmitting infections. They provide a barrier between the mouth and the genitals or anus, making oral sex safer for both partners. Just as with condoms, it is crucial to use dental dams correctly and to ensure they are not expired or damaged. Another key aspect of safer sex practices is open communication with sexual partners. Discussing sexual history, testing for sexually transmitted infections, and establishing boundaries are vital components of a healthy sexual relationship. It is essential to create an environment where both partners feel comfortable discussing their sexual health and any concerns they may have. This open dialogue can help build trust and ensure that both partners are on the same page regarding their sexual practices. Regular testing for sexually transmitted infections is another critical component of safer sex practices. Many STIs can be asymptomatic, meaning that individuals may not show any signs of infection even if they are carrying a virus or bacteria. Regular testing allows individuals to know their status and take appropriate action if they test positive. It is recommended that sexually active individuals get tested at least once a year, or more frequently if they have multiple partners or engage in high-risk behaviors. Knowing one's status not only protects the individual but also helps prevent the spread of infections to others. In addition to testing, vaccination is an important preventive measure for certain sexually transmitted infections. Vaccines are available for hepatitis B and human papillomavirus, HPV, both of which can have serious long-term health consequences. The HPV vaccine is particularly important, as it can prevent several types of cancer associated with the virus. Vaccination is most effective when administered before individuals become sexually active, but it can still provide benefits for those who are already sexually active. It is also essential to consider the role of alcohol and drugs in sexual decision-making. Substance use can impair judgment and lead to risky sexual behaviors, such as not using protection or engaging in sexual activity with multiple partners. It is important to be mindful of the effects of substances on decision making and to prioritize safety, even in social situations where alcohol or drugs are present. Setting boundaries and having a plan in place can help individuals navigate these situations more safely. Education plays a crucial role in promoting safer sex practices. Comprehensive sex education programs that provide accurate information about sexual health, consent, and relationships can empower individuals to make informed choices. These programs should address not only the mechanics of sex but also the emotional and social aspects of sexual relationships. By fostering a culture of open dialogue and education, we can help reduce stigma around sexual health and encourage individuals to prioritize their well-being. It is also important to recognize that safer sex practices are not solely the responsibility of one partner. Both individuals in a sexual relationship share the responsibility for maintaining their sexual health. This means that both partners should be proactive in discussing their sexual history, getting tested, and using protection. By working together, partners can create a safer and more supportive environment for their sexual experiences. In addition to individual practices, community support and resources are vital for promoting safer sex. Access to sexual health services, including testing, counseling, and education, can significantly impact individuals' ability to engage in safer sex practices. Community organizations, healthcare providers, and educational institutions can play a crucial role in providing resources and support for individuals seeking to improve their sexual health. By fostering a supportive community, we can help individuals feel empowered to prioritize their sexual health and well-being. Such as race, gender, socioeconomic status, and sexual orientation can influence access to information and resources related to safer sex practices. Marginalized communities often face additional barriers to accessing sexual health services, including discrimination, lack of culturally competent care, and limited availability of resources. It is crucial to advocate for equitable access to sexual health education and services for all individuals, regardless of their background. By addressing these disparities, we can work towards a more inclusive approach to sexual health that recognizes and respects the diverse experiences of all individuals. Furthermore, the role of technology in promoting safer sex practices cannot be overlooked. The rise of digital platforms has transformed how individuals access information about sexual health. Online resources, apps, and social media can provide valuable information about safer sex practices, STI testing locations, and educational materials. However, it is essential to ensure that the information available online is accurate and reliable. Misinformation can lead to confusion and potentially harmful practices. Therefore, individuals should seek information from reputable sources, such as healthcare providers, public health organizations, and educational institutions. In addition to online resources, telehealth services have become increasingly important in providing access to sexual health care. Telehealth allows individuals to consult with healthcare providers remotely, making it easier to access testing, treatment, and counseling without the barriers of transportation or stigma. This is particularly beneficial for individuals in rural areas or those who may feel uncomfortable seeking care in person. By embracing technology, we can enhance access to sexual health services and promote safer sex practices. Another important aspect of safer sex practices is the concept of consent. Consent is a fundamental component of any sexual encounter and should be clear, enthusiastic, and ongoing. It is essential for individuals to understand that consent can be revoked at any time and that both partners should feel comfortable expressing the desires and boundaries. Educating individuals about the importance of consent not only promotes safer sex practices but also fosters healthier and more respectful relationships. Moreover, it is vital to recognize that safer sex practices extend beyond physical health. Emotional and mental well-being are also critical components of sexual health. Engaging in sexual activities should be a positive and consensual experience for all parties involved. Individuals should feel empowered to communicate their needs and desires, and they should prioritize their emotional health alongside their physical health. This holistic approach to sexual health can lead to more fulfilling and satisfying sexual experiences. As we discuss safer sex practices, it is also important to acknowledge the role of stigma surrounding sexually transmitted infections and sexual health in general. Stigma can prevent individuals from seeking testing, treatment, and support, leading to negative health outcomes. It is essential to create a culture of acceptance and understanding around sexual health, where individuals feel safe discussing their concerns without fear of judgment. By normalizing conversations about sexual health and reducing stigma, we can encourage more individuals to prioritize their sexual well-being. In addition to individual efforts, public health campaigns play a crucial role in promoting safer sex practices on a larger scale. These campaigns can raise awareness about the importance of testing, vaccination, and the use of protection. They can also provide information about available resources and services, helping individuals make informed choices about their sexual health. Effective public health campaigns should be inclusive, culturally sensitive, and tailored to the specific needs of different communities. By reaching out to diverse populations, we can ensure that everyone has access to the information and resources they need to engage in safer sex practices. Furthermore, it is essential to involve young people in discussions about safer sex practices. Adolescents and young adults are often at higher risk for sexually transmitted infections and unintended pregnancies. Providing comprehensive sex education in schools and community programs can equip young people with the knowledge and skills they need to make informed decisions about their sexual health. Engaging young people in conversations about consent, healthy relationships, and safer sex practices can empower them to take charge of their sexual health and well-being. As we consider the future of safer sex practices, it is important to remain adaptable and responsive to emerging trends and challenges. The landscape of sexual health is constantly evolving, and new technologies, social norms, and public health issues can impact how individuals approach safer sex. Staying informed about these changes and being open to new ideas and strategies can help individuals and communities continue to promote safer sex practices effectively. In conclusion, safer sex practices are a vital aspect of sexual health and well-being. By understanding the importance of using protection, engaging in open communication, getting tested regularly, and prioritizing consent, individuals can take proactive steps to protect themselves and their partners. Education, access to resources, and community support are essential in promoting safer sex practices and reducing the stigma surrounding sexual health. As we work towards a future where sexual health is prioritized and celebrated, it is crucial to foster a culture of acceptance, understanding, and empowerment. By doing so, we can create a healthier and more informed society where individuals feel confident in their ability to engage in safe and fulfilling sexual relationships. Ultimately, the goal is to ensure that everyone has the knowledge, resources, and support they need to make informed choices about their sexual health, leading to healthier individuals and communities.